Hey, how's it going? My name is Matt. I'm a physical therapist at Change Sports Physical Therapy in Huntington Beach. And I just wanted to introduce you a little bit about our method for getting people out of pain and back to doing what they love. So if that's what you're looking for, to get out of pain and get back to doing things that you love, I just love to explain to you how we do it here. And you might not know what physical therapy is, or you've been to physical therapy and you're like, man, I'm not sure if I need that. So let me quickly explain to you, this is how we do physical therapy. And just broadly, I love the term about physical therapy, and the way it's defined is the art and science of healing. And so this is our art to the science of healing and physical therapy. All right. So the first step here is called this recovery roadmap. And we have a PDF you can download on our website called the 5 Steps to Get Out of Pain Guide. And that's what I'm going to explain a little bit here. And so we have 5 steps that we walk every patient through when they come in. The first one, all right here, is we're going to just put evaluation. If you can read that right there. So this is our step 1. And what we do in an evaluation is we have a lot of our clinical tests and things that we'll go through. But there's 3 questions I'm trying to answer in an evaluation. Number 1 is what tissue is at fault, or what tissue is causing the pain. So is it a muscle thing, a ligament thing, what's going on there? The second one, and kind of more importantly, is what are the stressors that led that tissue to be strained to the point of having pain or failure, tissue failure. For example, you have a pulled quad, or you have Achilles tendonitis. What are the stressors that led you to have that overloading of your Achilles or of your quad? And number 3, the question we're trying to answer is, what stage of healing are you in? Are you in the inflammatory stage or not? And that's really the main thing I'm trying to get out of that. And that helps us know, where do we start your recovery process? So evaluation is number 1. Next, the evaluation, what we go into is you begin in this calming phase. And I got my lovely writing here. So number 2 would be our calming phase. And what that does is, our whole goal is to get you out of the inflammatory stage of healing. So if you have a pain at rest, if you have muscle spasms, swelling, all those things are the first phase is to get you out of that phase into the calming phase. From the calming phase to the next phase. All right. So we don't want to be doing any hard stretches. We don't want to do any hard strengthening at this point. The way to think about it makes sense. If you fracture your leg, you're going to need some time for all that to mend and to heal and to calm down before you want to begin trying to train for your next marathon, right? So you got to go in stages. So if you have an injury in your shoulder and your back and your ankle, whatever's going on, the first thing is to get you in this calming stage, out of that calming stage, and all our effort is into that. All right, the next stage here, hopefully you can see all this on the screen. Number 3 would be our mobility stage. And what that is now that we've got it calmed down and we've got you swelling down, no pain at rest, you can kind of it's okay. What we try to do in this stage, all our effort goes into gaining mobility and stability in the joint. So what that looks like is, I have a shoulder issue. Now we're looking to get that range of motion in the shoulder and the stability to be able to do your basic activities. Call that functional mobility, or just mobility for simplicity's sake. It's not just getting it to move, but getting it to move appropriately with your neuromuscular system and stabilization required. Okay. The next stage from that, and I'll just kind of bring it back up here, number 4, and that would be our strengthening phase. So I'll just put strength in there. And so now we've walked you through the evaluation, we found out what's wrong, we've calmed things down, we've gained mobility and the stability you need, and now we can start loading on top of that to increase your body's capacity to take on load. So for example, we'll go back to the Achilles tendonitis thing. We found out what was causing some issues. Maybe it's a foot structure issue, maybe it's just a training issue, maybe it is a mobility issue in your ankle or in your hip or something going on. And we've calmed that down, we've addressed those mobility, stability issues. Now we can begin to strengthen that a little bit. So now we start adding on more load, whether it's with squats, lunges, different loading exercises, right? And then the fourth and final phase, which kind of gets you back up and out, and then we'll put number 5. And then this one is what everybody wants to do, return to play. So we call that return to play phase, and we can throw a party as we come to here. And what that means is, whether you're playing sports, now we gradually introduce you back into your sport, and it's so important to have gradual steps and understanding of what things you can and can't do as you go back to it. If it's running, get back to running. If it's working in an office, it's like teaching you what things you can do in your office workspace so you don't get injured again. If it's whatever activity you're going back to, it's not just playing in a sport, but playing in life, or maybe it's a hobby or gardening or whatever it is. This phase now is helping you kind of reintroduce you back into that phase, so teaching you what you can do on your own, so you don't get injured again. And so that is the recovery roadmap. That's what we try to do with every patient. Of course, it's easy to say on camera, and it seems kind of simple and basic, and it is. It's not any rocket science. It's not something like a formula that we have the rights and the patent to, right? But this is just the basic phase that we were very purposed in what we're doing when we come here. We're gonna walk you through all these. And sometimes people get stuck at different phases. Sometimes you can't get out of that calming phase, and so we need to. That's where the art and the science comes in. Okay, how do we get this inflammation down? What's causing it? Maybe we need to go back to this evaluation because maybe we missed something. Maybe there's some stressors here that we didn't catch, and so that's the art of what we're doing. We progress you, then we start going to the strengthening phase sometimes, and we went too far too fast. Now we've dropped you back down here. We need to get you back into mobility, strengthening, return to play. So that's a little bit about us here at Change Sports Physical Therapy in Huntington Beach. If you have any questions, we just love to be the most helpful clinic around. Give us a call, email, Facebook, Instagram, DM us. We have a chat function on our website. Any way that you want to reach us, just try to reach out to us, and we'll see if we can help you any way we can. All right? Have a good day.